to all of you out there joining us today on this video cast for reporting, recording, and remembering the 1918 influenza epidemic, a timely research symposium made possible through cooperation with our colleagues at Virginia Tech as part of the ongoing partnership between the National Library of Medicine and the National Endowment for the Humanities to collaborate on research, education, and career initiatives. Today, we will be learning the research outcomes of Virginia Tech students studying the history of data in social context through individual and collaborative primary source research here at the National Library of Medicine, the Library of Congress, the National Archives, and other collections, and as part of their course, Topics in the History of Data in Social Context, being taught this semester by Dr. Thomas Ewing, professor in Virginia Tech's Department of History and Associate Dean for Graduate Studies and Research at Virginia Tech's College of Liberal Arts and Human Sciences. During our symposium today, the students will present their research on various aspects of the 1918 pandemic, including newspaper reporting at the peak of the epidemic, late September to early November 1918, contemporary social distancing policies and procedures, and how contemporaries determined that the epidemic was ending, as well as how they remembered the remarkable experience of this intense but relatively brief crisis in community health. I'll be serving as one of the discussants along with Dr. Nancy Bristow of the University of Puget Sound and author of American Pandemic, The Lost Worlds of the 1918 Influenza Epidemic, published by Oxford University Press in 2012, and Deborah Thomas, Program Manager for the National Endowment for the Humanities supported National Digital and Newspaper Program and Chronicling America at the Library of Congress. Also joining us will be Dr. David Morins, Senior Scientific Advisor at the National Institute of Allergy and Infectious Diseases. Before I turn things over to Tom Ewing, I'd like to thank Tom certainly for our collaboration in this regard, and certainly also the National Endowment for the Humanities Office of Digital Humanities for co-sponsoring this symposium as part of the NLM-NEH partnership. I'd also like to thank my NLM colleague, Lindsay Franz, and everyone at NIH Videocasting for their contributions to making this webcast possible. And certainly, again, to Tom and his students, as well as our discussants, Nancy Bristow, Deborah Thomas, and David Morins. One final note, for those who wish to see the closed captioning of this program, select the CC icon on the videocast. And for those on Twitter, please use the hashtag NLMHistTalk to follow along and share questions. So with that introduction, I'll turn it over to Tom Ewing. Tom?
Thank you, Dr. Resnick. I very much appreciate the introduction and especially appreciate the support that you've provided the History of Medicine Division at the National Library of Medicine. As you mentioned, Lindsay Franz, who's helping with the technical side of this, and all of your colleagues. It's really been a wonderful partnership with your office, with your library, and also with Virginia Tech. And so I welcome this chance in unexpected circumstances to make this and continue this connection. What you see now is a list of the student participants in this project, and I'm going to introduce them here in just a moment, as well as you mentioned the three discussants listed here, and also we hope to have Dr. David Morins join us as well. I want to just follow up on what you said and welcome the three discussants, Professor Nancy Bristow, author of American Pandemic from University of Puget Sound, Deborah Thomas from Library of Congress, and Dr. Jeffrey Resnick from the History of Medicine Division at the National Library of Medicine. All three of these discussants have been wonderful partners on previous projects involving Virginia Tech, and also particularly around the 1918 Spanish influenza. Dr. Bristow has made 2 visits to Blacksburg to speak to a teacher seminar sponsored by the National Endowment for the Humanities in the summer. Deborah Thomas welcomed these teachers twice to the Library of Congress, where they could do research on their projects and meet with both the staff in this newspaper reading room, but also other parts of the library. And Dr. Resnick has welcomed the teachers to the National Library of Medicine a couple times, and has also welcomed Virginia Tech students to come up and present their research, meet with the staff, use the collections. And so it's been a wonderful opportunity for me to create these spaces for students and teachers to learn about this topic and think about why it matters. I want to say a special thank you to Dr. Morens and also his colleague Dr. Jeffrey Taubenberger. You can see in the photo that in 2015 for the NEH sponsored seminar, Dr. Taubenberger was able to meet with the teachers 3 years later in 2018. Both Dr. Morens and Dr. Taubenberger had a chance to lead this seminar. As you can see, they are both very, very, in very, very important positions these days. And I appreciate their continued interest in these research projects, in studying history, and particularly welcoming the chance for students to talk about their research. I'm very pleased that Dr. Morens, I think, will be able to join us later today as a discussant in this symposium, but I appreciate that things are extremely busy. And this does give me an opportunity to say an incredible important thank you to the National Institutes of Health, specifically the National Institute of Allergy and Infectious Diseases, the National Library of Medicine, National Center for Biomedical Information, and generally U.S. Public Health Service. I think we've appreciated in the last few weeks how incredibly important it is that we have knowledgeable, dedicated, and persistent people in these positions taking care of not just the American public health, but global public health. And this is something that's come up, obviously, in our own research projects, but it's something that has come up frequently in the conversations with students and in the other work I've done. So I will take this opportunity to say thank you for what you're doing. I wanted to also extend a real statement of appreciation to the 12 students who are in this class this semester. As I'll explain in just a moment, when they signed up for courses in October of 2019, they had no idea what they were getting into. And I appreciate their sticking with this class in very, very different circumstances. I've put on this, not only their photographs, but where they are now, because we are not, Virginia Tech did not resume classes normally after spring break. And not only did that mean that the students were geographically dispersed, but their lives in many cases were really disrupted. That they've been dealing with not only taking classes in a completely new and unexpected way, but I know from talking with them, as well as other students and my colleagues, many of them have had to deal with unexpected situations in their families, in some cases illnesses themselves, trying to help out as they can when, perhaps their parents are now taking responsible for school-age children. And so what they've gone through is in some ways a microcosm of what the whole country is going through. But I really appreciate, that they have been willing to continue working on this project all the way through. And it's, very, very happy to give them the opportunity to talk about these projects. When we were discussing this presentation and the opportunity, what we've learned from working with the historical materials, but also going through a related situation these days, one of the things that came up, and then I wanted to give them a chance to articulate, was appreciation for people who are now caretakers, nurses, physicians, emergency medical technicians, all of the first responders. So these are some of the names that they suggested, the students in my class, people that they're thinking about, whether these are family members or friends or colleagues. And so again, it's just a chance to acknowledge that publicly and say thank you. And just be aware of, people are facing some very difficult circumstances and yet really contributing as they can. So this was a chance to acknowledge that as well. I'm going to provide just a little bit of background on this class and what happened. And I've divided it. I'm a historian, so I think in terms of narratives and dates. And so the class is divided into part one before COVID and part two after COVID. The course is, as Dr. Resnick mentioned, is called Topics in History of Data and Social Context. It's the first time this course has been taught at Virginia Tech. And when I set up the course, both with the fall course registration, and then when we started meeting in January of 2020, I had a couple of questions in mind. I wanted students to think about how deaths and influenza cases were counted in 1918. How did people respond to the epidemic? What did they think mattered? What was important? And then what did this particular set of issues, counting data, reveal about some of the early stages of epidemiology? And when the students came to our first meetings in January, I said, that we were going to go up to the National Library of Medicine in Bethesda in April, which seemed a very, very long way away. And we were going to have a chance to meet with specialists, work in the library, and they'd have a chance to present their research. And kind of a extension on that, there were really kind of three areas that I wanted the students to think about. The first was to do a newspaper case study and to use newspapers, historic newspapers available from the Library of Congress, from the Chronicling America collection, because this is one that's publicly available. Anyone in the country can use this. And so it made sense in terms of the kind of replicability of this research to be able to do it that way. But I also picked newspapers that came from states and cities and rural communities that in many cases have been omitted for most of the major research on the 1918 influenza epidemic. And in some ways these were, I thought, representative broadly of the country. And you can see on the map which states we ended up with. And a set of research questions that I asked the students to start working on as they made their way through these digitized newspapers. So that was the first one, was this kind of newspaper case study. What were people thinking about? How was the news being reported as it happened? The second part of this was to look at the United States Census. Every year in the early 20th century, they put out a volume, in some cases multiple volumes, of what were called vital statistics. But these only came from the registration states. So there are 31 registration states in 1918. And as you can see, it's not broadly representative of the whole country. It's very, very representative of New England and the Mid-Atlantic and kind of Ohio Valley, and then sort of odd stretch across the middle of the country and the West Coast. But there's a large section of the country that's just not involved. And you can't get the same information about deaths and cause of death and age of death and so on for all of these other states. And so part of what we wanted to do was to look at the census and how they reported on vital statistics, but we also wanted to find other information. And so what we started to do was to look at the annual reports that were put out by the states for 1918 and look at some of their more granular information about this disease and how it transpired. And again, looking at reports on influenza deaths by age, in some cases by region, by county, in some cases by month, and to think about how, in this early stage, in the early stages of this disease, these health departments were very actively involved in epidemiology. They were trying to keep track of these records and understand what was happening. So these were sort of the three parts that I was asking students to look at during the first 6 weeks of the course. And then things changed. So the students left for spring break early in March. Halfway through spring break, they got an announcement that the university was converting all the classes to online, to remote learning. They should not come back. And that's when this class, along with all the others, changed to this format. We had to cancel the trip to the National Library of Medicine, first because Virginia Tech prohibited all travel. And then soon after that, the National Library of Medicine closed. And so when the students came back, I asked them if they wanted to continue working on this project. And I did give them some options to do something else, but they all wanted to keep working. But then they really wanted to change the questions that they were asking about the 1918 epidemic. They were interested in the ways that looking at newspaper reporting could inform their following the news about COVID-19. How to evaluate the accuracy of news, how to think about what's significant, how to balance, short-term changes with long-term processes, how to evaluate recommendations of public health measures. They were also very interested in how effective was social distancing in 1918. Many of the practices that they were being asked or required to follow were the same ones that were implemented in 1918. So they were interested in how do we know if those were effective. They suggested a question, which I very much appreciated, which is, how did people know the epidemic was over? How did they know, when things were getting better? How did they anticipate a possible second wave or another wave of the epidemic? How do they remember the epidemic? And here we are also obviously very inspired by Dr. Nancy Bristow's work in American Pandemic of thinking about remembering this epidemic. But they also wanted to think about the lessons that could be learned from studying this. And so it was following, kind of the recalibration of these questions that then the students began working in these 4 groups. And we came up with the title that became the title for the symposium in terms of reporting, recording, and remembering. And so you're going to hear in just a few minutes from each of these 3 student groups, 2 students from each presenting, what they've done in terms of looking at these materials and the lessons they've taken from that and how that relates to what we're going through right now. Virginia Tech did a story about what the students learned or were learning in this course, which I very much appreciated. And like I said, we'll get to those presentations in just a moment. But in thinking about how to frame what the students are presenting, it reminded me of how important history is during an epidemic, why history matters. As I mentioned at the beginning, you appreciate the importance of expert medical knowledge and informed health advice. There were certainly instances of this in 1918, but there are also some instances when the advice was bad and it was poorly framed and it was not helpful. So we can see that. We appreciate that behaviors, attitudes, and interactions have consequences. The way people behaved as individuals, but also as a society, the decisions made by governments did matter in 1918, and I think we can learn from that. We can also understand the events, the statements, and especially the numbers related to the epidemic, whether that's in 1918 with influenza or in 2020 with the coronavirus. But I want to pick up on the last of these reasons to think about history in an epidemic, because it's become really kind of central to how I approach this course, but also to my other activities, which is the importance about cultivating empathy for people as they experience different and frightening circumstances. I've been in a situation for the last couple months where what I'm reading in the news, what I'm hearing, talking to family or friends or colleagues is, frighteningly similar to what I'm reading from 1918 in terms of newspaper articles or looking at statistical information and looking at statements from public health officials and making predictions and so on. And this is something that the American Historical Association has identified as one of the key skills that history classes should be teaching. History is the study of the human past as it is constructed and interpreted with human artifacts, written evidence, and oral traditions. History requires empathy for historical actors, respect for interpretive debate, and the skillful use of an evolving set of practices and tools. And so one of the reasons I've selected this photograph and used it at the beginning of this presentation, and it was used in the news article that's on Twitter and various other places, is I spent a fair amount of time trying to think about what was happening with the people in this photograph. And there are lots of ways to research and to think about developing empathy for historical actors. Certainly in the case of the 1918 influenza, you can read letters, you can read diaries, you can read public statements, you can read editorials in the newspaper, letters to the editor. I mean, there are ways that people articulated their experiences of this disease. And I think, again, Dr. Bristow's book, American Pandemic, is a fabulous example of this, really thinking about how do you understand the experience of patients, of nurses, of physicians, of community members as they go through this disease, this epidemic. But I was trying to do something a little different in this course, which is to ask how we can use numbers and statistics and data to also cultivate this sense of empathetic understanding in history. And this is challenging in the case of this photograph because the people in this photograph are not identified. We don't know who they are. There are, as far as I can tell, no names. There's no location other than New York City. What we have are two pieces of information. And this photograph comes from the National Archives in College Park, Maryland. And it's contained, believe it or not, in a binder, a 3-ring binder, that has the label Spanish Flu Epidemic 1918 on the spine, along with a skull and crossbones. And you can see the photograph in that collection. And then on the back of the photograph is the caption, which lists the name of the photography studio, Underwood and Underwood in New York. It gives you a caption: masks for protection against influenza. Girl clerks in New York at work with masks carefully tied about their faces. So that's all useful information. But it also has the date on it, October 16th, 1918. So that lets us put this photograph into a very specific geographical and chronological context. Now, this photograph was published in a newspaper. This came from Chronicling America, and specifically the Sun newspaper in New York City from October 27th, 1918, so about 10 days after the photograph was taken. And there is a caption. It's pretty similar. Girl clerks at work with influenza masks to prevent the spread of the epidemic, which has crippled many business houses. Same photograph. So we've got the situation where we have a photograph and captions, which are pretty similar. But what's most useful here, as I mentioned, is the timing, because we don't know who these 4 women are, but we know what was happening at the moment this photograph was taken. Because if we look at the Sun newspaper from October 17th, 1918, there is an extraordinary number of victims of the influenza. 10,266 in day fall victims to grip here. Doctors failed to report more than 50% of cases, disease sweeping on. I mean, these are stunning and graphic headlines that tell us at the very moment this photograph was taken, this was the context in which these women were doing their work. So there are ways to think about numbers as part of this context. So the New York Health Department provided a daily account of the number of people in the city who died from pneumonia and influenza from the middle of September through the middle of November of 1918, so about 2 months. And the red line obviously indicates October 16th, precisely at the moment that that photograph was taken. And as you can see, both influenza and pneumonia cases are on the rise and have been for, at this point, about a month, and they will continue to do so in the days to come. This was an important way that the New York City Health Department kept track of what was happening. This is a chart that was published 2 months later in December 1918, showing exactly this increase in the daily deaths from influenza and pneumonia in this epidemic. And again, the red line shows what was happening at the time that photograph was taken. If you break out the deaths from influenza and pneumonia, you can see that the pneumonia deaths were actually starting to level off a little bit, but the influenza deaths day by day were going to increase and remain at a pretty high level for another 10 days after this photograph was taken before they start to decrease. And here the influenza deaths, as I said, are going to keep going up a little while longer. But if you were in New York City on October 16th, you were in the midst of, a very frightening increase in the number of people around you who are dying from this disease. The New York Health Department also kept track of the number of cases. And so the dashed line in this case is showing the number of cases. And as we've known for the last several months now going through COVID-19, this is the question about how do you keep down the number of cases, flatten the curve, and keep the number of deaths down. So this was also something in 1918 that public health officials were very, very aware of and very concerned about. And so in this case, what you see is that the number of cases goes up faster than the number of deaths. The number of cases peaks about 2 weeks before the number of cases does. Now, these are actually weekly results, so they're spread out a little bit more than if you look at the daily count. But again, on October 16th, if you look, both the number of cases and the number of deaths are going to continue to increase. The number of cases will hit its peak in a few days, and then it'll start to go down, but the number of cases is just going to keep going up. So again, if we think about what's going on in the context surrounding these girl clerks, as they were called, this is a really important thing to think about. The health department also provided statistics on the percent who died. Excuse me, I got this going backwards. From influenza. And so you can see in the early stages of this disease, when the number of cases was going up very quickly and the number of deaths that are not going up as quickly, it's a relatively small percent of those who were reported with influenza who are dying. That changes. And actually, once you get past the peak of this, the number of cases and the number of deaths both go down, but the percentage of reported cases who are dying actually goes up. So this is something else to think about in terms of this context, and also how we take these lessons from 1918 to think about what's going on right now. 2 more ways you can think about the context using these numbers. The health department reported the number of deaths by occupation, and office clerks was one of the occupations that the highest number of deaths from pneumonia and influenza, and half of those approximately were women. You can also see the age group, presumably that would include these girl clerks. They aged from 20 to 34, made up just over a quarter of the total population, and yet almost half of the deaths from pneumonia and influenza. And one of the characteristics of the 1918 influenza was this unusually high mortality in the age groups of the 20s and 30s, which was very unusual for influenza. So these are all ways that when we think about this photograph and ask what was going on in the lives of the people in 1918, we can combine this visual evidence with the statistical materials and really kind of put them in this context and think about, as I mentioned at the beginning, how we can develop this empathy, not only for what was happening in 1918, but how that can then inform the way we think about the current epidemic or future outbreaks. So that's some background on the course, on what we are hoping to accomplish early on, and then again, once we got to the next stage. So at this point, I'm going to turn it over to our first 2 presenters from the Influencing the Influenza project, and they're going to tell me when they are ready to start and when they are ready to advance the slides.
Okay, I think we're ready. So we're going to be reporting on the epidemic, and my name is Luisa Glazunova. I worked with Fiona, Ian, Eliza, and of course, Professor Ewing. Fiona and I will be bouncing off of each other, so we'll just keep in mind that. Okay, next slide. So these are the cities that we had focused on that Tom had mentioned a couple minutes ago. So the 12 cities. The 3 of us specifically pulled examples from Hickory, Chattanooga, and Salem, which is where you will see some of our headlines that we mentioned a bit later in the PowerPoint. We focused on these different areas of the map that helped us pull together a better picture of what was occurring in the United States. So it kind of pulled like different areas. Yeah, so you can see that on the next slide, this one. This is a graph illustrating the 12 cities and their population based on the 1920 census. So the lighter the circle, the larger the population. And out of the 3 that we focused on, Chattanooga was the largest, followed by Salem and Hickory. So unfortunately, Google Graphics isn't really colorblind friendly, but as I said, the lighter the circle, the higher the population. Next slide. So we wanted to look at the tone over the time period that this epidemic occurred, and we wanted to focus on what kind of message or tone was being broadcasted to the public. So we found that each city had many examples of both flashy and alarming headlines that reported tragedies and could create panic in the public. But as the influenza began to worsen in the late October and November stage, more headlines were actually took preventative measures to calm the public as their fears began to appear. So we wanted to dive into that. We were intrigued with the reactions that the public had to the messages that were being broadcasted, and we think that it definitely related to how the epidemic was handled, which will be touched on in the other groups. Next slide. So this is a timeline of the apexes for each of the 12 cities that we looked at. As you can see, the majority of the first wave peaks were centered in October of 1918. We focused on the first wave because the majority of our headlines and news sources we were able to pull from those actually. So as we had mentioned in the early stages, the newspapers were reporting with alarm and panic tone at first, but nearing January, that switched completely to a more calm and relaxed tone. Next slide. So this is a word cloud consisted of the words that we pulled from the headlines. As you can see, the big or bolded words consist of panic, deadly, bullets, death, and quarantine. The one that stuck out to me the most was actually epidemic, just because we have been using it kind of interchangeably with pandemic, and I thought it was interesting to connect that to what what's happening with us today. And also the littler words, words such as good, care, calm, time, and doctors were less common throughout the newspapers, but they definitely had some impact. Next slide.
My name is Fiona, and I'll be taking these slides. So we found lots of examples of public scares in the case studies that we looked through. Headlines that compare the pandemic to the World War were often made, such as influenza is worse than bullets, were actually publicized in both Chattanooga and Salem. Phrases like rapidly spreading, until danger passes, and deadly disease drew the reader's attention to statistics reported on the number of cases and deaths within these different cities. These words were used to capture the attention of daily readers to get the public to understand how impactful the pandemic really was. And there were also articles of wild stories, such as a Portland doctor who was scared into suicide for having the influenza, although he didn't even contract the flu at all. So these stories and the word choices that the articles had really shocked the readers into taking precautions more seriously during the peaks of the influenza. Next slide. So Professor Ewing helped us by creating this visual that really shows the impact of the influenza at its peak. Each front page in October 1918 from the 12 different newspapers were totaled up to show how often the influenza was mentioned as a percentage. A third of these newspapers mentioned influenza every day for the entire month, and were all located around the Midwest. So from this graph, you can tell much of the news was revolved around this crisis. So it was really crucial that the information being consumed would help the public prevent the pandemic from growing. Next slide. So oftentimes the newspapers were also reassuring to the public when many of the citizens don't really know how to react in a crisis such as this pandemic. So whenever there was improvement in the city for no new cases or a decrease in deaths, newspapers would also have this good news to remind the community that their cooperation is effective. Some articles were more informative on warning readers to be like one step ahead of the flu and to not be alarmed and be careful about their actions. So in this article from the health department in Chattanooga, experts had advised how to take care of those who have influenza and how to take care of themselves. So suggestions similar to today's like social distancing, such as making sure to stay away from others and to just go to sleep at home if you have the flu, were often mentioned as well. Next slide. So both these tones really helped carry across the real message of these articles to be informed and to prevent the spread of the flu. News about how each city was handling the pandemic was important for citizens to consume, and newspapers were the best way to spread this information about regulations and restrictions at the time. Public bans and preventive measures were really important to follow, such as not going to school or wearing masks. It was only the cooperation of the citizens in each city to really do their part in helping to keep their community safe and reduce the cases and deaths. Next slide. And it was also really important that credible sources released the information about preventive measures. In the Chattanooga news, the United States Public Health Service had a statement by the Commissioner of Health that took up a fourth of the page in the newspaper to, quote, deliver the most accurate information attainable in regards to the influenza, that it may be brought to the attention of every man, woman, and child in the city of Chattanooga. Similarly, physicians in Salem came together in a discussion to reassure the public that no drastic measures such as closing the town were necessary in October. But as they were receiving the news of the rest of the country in much worse conditions, and later, it wasn't until once Salem hit its peak that the mayor of Salem had announced a ban on public gatherings when the influenza did reach the West Coast. And in Missouri, the Columbia Board of Health, along with the mayor, made announcements of closing public schools in the city to prevent the spread of influenza. Next slide.
So this is Louisa again, and we're going to finish off with the connections that we made to the coronavirus. So we looked at articles from NPR, Ohio News, and ABC News. So we decided to dive into these connections just to see if the media and the public were reacting the same way as they were about 100 years ago. So the first one is just coronavirus and anxiety following the news made me have a panic attack. So I interpreted that as the news that they were broadcasting was negative and made them have a panic attack after reading it. So it's definitely not good. The next one is Americans panic and play during the coronavirus. So definitely some people aren't taking it seriously while others are in a panic. And the last one being the news is making people anxious. You'll never believe what they're reading instead. So the pandemic has driven people into uplifting headlines or the opposite. Next slide. So these are a little bit more positive aspects of the news. If you're feeling anxiety, a psychologist offers tips to stay clear-headed. Is there light at the end of the tunnel? 6 signs to look for. And lastly, Coronavirus Chronicles. Here's some good news amid the dire reports. So the biggest difference that we saw between these newspapers being released is actually the different time frames. So as we said in 1918, there was like the difference in tone was between the peaks of the epidemic, following like when it's actually getting bad or worse. But through the coronavirus, it's like, it doesn't depend on the time that they're being released. It's just the news source as to which releasing. So if it's ABC or CNN, whichever news source you look at, they both have different tones, which I thought was interesting. Next slide. So in conclusion, when we were studying the tone of the newspapers throughout the 1918 pandemic, we concluded that the reason why we were looking through all this information was to figure out how it was being released. We found that the different techniques of news being released impacted the overall public reaction, which correlates to how the pandemic was handled from each part of the world. Thank you.
Thank you, Louisa and Fiona and your project members, Ian and Emily. Okay, so and just to those of you who maybe joined us, we're going to go through the 3 presentations, and then we'll have comments from Nancy Deborah Thomas, Jeffrey Resnick, and David Morans. If you do have questions, if you're watching this on the live video cast, you can tweet those to NLM HIST Talk, and we will gather those up and direct those back to the student teams. So at this point, we'll turn it over to I believe Jacob and Yash and their group.
Hi, everybody. Thanks for hearing. So my name is Yash. Presenting with me is Jacob, and we decided to research on social distancing and how it was relevant in 1918 and 1919. Matt, me, Jacob, and Connor, and of course, Mr. Ewing, we all contributed on this presentation. All right, next slide. So kind of starting off, we wanted to actually look at the differences in the type of social distancing that was either enforced or recommended in 1918. And that made a big difference, as we'll see later on, but to kind of split up the various categories here, Recommended everywhere, there were basic pre-measures covering when you're coughing, staying home if you're sick. Masks should be worn by medical staff, and to generally stay calm for, like mentioned in the last presentation, public reassurance. Enforcement, while limited, included mandatory masks, businesses being closed, and actually prohibiting activities relating to the war effort. Now, why didn't all states directly go into enforcement from just recommendation? And that's kind of where we bring the variables. So what changed was the state, the county, the population, the timeline of the city itself. And we'll get to this later on in the presentation, but some of the ones that changed were whether schools were closed, whether churches were closed, public gatherings, prohibitions, masks in public. So that's kind of the middle section between just recommendation and actual enforcement. Next slide. So for social distancing, we decided to study Indiana and Missouri. This for a bunch of reasons too. The annual reports included specific county and state level data about cases and deaths, and these acted as almost as controls that when we went back into the newspapers to look for daily or weekly data, we could compare it back to the annual report. Both these states are registration states for 1918. Both these states imposed closing orders early in October, which gave us a common timeline on which to compare the types of social distancing that was implemented and to look how the death rates for influenza and pneumonia changed. Both these death rates were close to the national average, so we know we weren't looking at any outliers. They had an even distribution of urban and rural populations, and we'll see in later on presentation why this was important to actually look at the crisis. The major cities, St. Louis, Kansas City, and Indianapolis, were included in the influenza encyclopedia, which had done a lot further research than we had. So that also acted as a comparison and a control. The newspapers were available from the Chronicling America. They were limited, but we found that it was sufficient enough for our use. Next slide. Yep. So this is kind of going back to comparing the population between these two states before we move further into the city and county level data. So the population for these two states, Indiana with 2.8 million, Missouri with 3.4 million. I think it is important to look at the distribution in cities and outside cities, where in outside cities is actually a lot more than half the percent of the population were outside of cities, meaning more rural towns, places with less exposure to extreme or emergency medical attention. And this ultimately led on to play as a factor in determining the death rate of influenza. Next slide. This is kind of more of a visual summary of comparing Indiana and Missouri to all the registration states that were included in the 1918 report. As you can see, they racked up to the total deaths. So Missouri was, as you can see near the top, Missouri and Indiana were close in their death, in the total deaths. And we knew we're working with somewhere of a median or an average of the total deaths, because New York, obviously the most population, it was really high up there. And then we have states like Utah, Vermont, which are really low. So we wanted to pick a couple states that were kind of in the middle, so we get some significant numbers, as you can say. Yep, next slide. Yeah, go ahead, Jacob. Hey, Jacob.
Oh, my bad. I didn't realize I was muted.
Oh, you're good.
Okay. Is there any way you could go one slide ahead and then come back to this one after? Okay. So yeah, this is for Missouri from October 10th, Butler Weekly Report. And this is just an article or a little piece talking about the mayor of Butler County sending out an order to close schools, churches, lodges, and public gatherings throughout their locality. So we see here that, like, as the flu started to get bad, these localities are starting to take action sooner than the states have. And that's just kind of they began to take action fairly quickly. And then do you mind going back to the slide before? So this is actually one day after the previous slide. And this is an order from the governor, essentially saying the same thing that that Butler County said the day before, is that, they're getting rid of public gatherings, no churches, kind of just shutting everything down on a state level. All right, next slide. Or one more. So here we see Indiana taking similar measures to Missouri. They actually began this 4 days before Missouri did, with a state order shutting down schools, churches, places of public amusement, and forbidding public meetings. So, yeah, this is just kind of a case of Indiana beginning to take action relatively quickly compared to other states. And yeah, next slide. So we see here that despite Indiana actually taking statewide action before Missouri, they still had a massively higher cases and case rates per thousand than Missouri did. Although you can see that they both had a similar timeline in terms of rise and peak and the fall. So, yeah, that's kind of the question we're asking is, why did this happen? Why did Indiana, despite shutting down days before Missouri, have such a drastically higher case rate per thousand and total cases? So, next slide.
Yep. So this is where we were looking at. So like Jacob mentioned in the previous diagram, where Indiana had such a higher curve than Missouri, even though both had a similar relative timeline, and we assumed that the social distancing was at least implemented in similar ways. We kind of dived into the county level population data here, and we looked at Indiana county by county. And what we were looking at was total deaths relating to the total population, which means a higher population should correlate with an increased number of total deaths. However, in two of the counties that we've highlighted, this is where this correlation was actually inverse. Floyd County and Marshall County, these were two of, not the lowest, but two of the lower populations. However, they had relatively high death rates. And we wanted to highlight these, and as you can see next couple slides, highlight the counties which displayed this kind of behavior to hone in and say, ask the question as to why is this? Is this because of the lack of medical attention, or is this because of the lack of social distancing implementation throughout the county? Next slide. So this is death. This is relating to death rate, not just total deaths. So the ones that are highlighted, as you can see in the analysis, the death rate did not correspond to total population in counties. And like I mentioned before, counties with high death rates included many counties with relatively small populations. And it's important to look at the death rate and not just the total number of deaths. We believe that it gives a better proxy to kind of compare different counties. And, Newton County, just to highlight a couple, 87th in population, but for number one in death rate. And this was concerning because we expected social distancing throughout the state in one uniform order. However, this wasn't the case at all, as we'll see. Next slide. So this is specifically the death rate from influenza. And again, we kept seeing that the highest death rates were from counties with low populations. Lake County, as you can see, was one exception to that, which was one of the highest populated, and it was one of the highest influenza rates. Now, Lake County, I guess, is kind of an exception because it was an extremely urban town. It's an urban county, and it didn't lie on the same scale as comparing the rural counties. This was a different factor that we were playing with. Next slide. Yep, and to kind of summarize the same data from Missouri, counties with low populations had high death rates from, as you can see, all causes, as well as pneumonia and influenza. Some of the counties, just to highlight them, the highest death rates, Dunklin County, we have Springfield County, Sedalia County. These were counties with relatively, these counties had high-ish populations, but as well as high death rates. And when we go down to low counties such as Carter County, only 5,000 people, yet the pneumonia influenza death rate was 8.36, relatively high. Next slide.
All right. So this is a newspaper clipping from Lake County, which, as we previously saw, had the 6th highest influenza rate in Indiana. And in this, they decided to extend the closing order by a week. And, they talk about, they have the guidelines for no political meetings, no, public gatherings of any kind, all that stuff. But it says in the clipping that thoughtless individuals made it hard for them to enforce the orders. So political meetings are still being held. People are making an effort to open theaters, and some people are even going to funerals claiming a relationship to the deceased. So that definitely played a role in Lake County's significantly higher influenza rate. Next slide. So here it's looking at Missouri again, and they're talking about like how they're counting the number of cases, and a lot of people thought that the situation may have been getting better, but as it turned out, physicians had been very late in reporting their cases, and some people had been ill for like a long period of time before it was reported. So it like almost had a resurgence. There was no true resurgence because they were already sick, but just in terms of public perception, this came back. And Dr. Norris, a secretary of the Board of Health, he was saying that the situation was no better in the county and city than it was in the military areas. Next slide. So this is talking about opening up Missouri again, and the first things that were reopened were schools, because it was a lot easier to, they already have control of the population in the school, given that, the adults have the authority over the children. So it was a lot easier to follow the guidelines in that setting than it was just in the general public. Next slide. So here it's talking about, so they opened up the guidelines from their previous bans on public gathering and social distancing guidelines, and there was a resurgence in cases, approximately 300 in the city. There were fewer deaths, but as it says in the last sentence of this clipping, many doctors thought that the lifting the ban on public gatherings was a mistake, and that it brought on a much worse situation than they were previously in. Next slide.
Yep. So to kind of conclude, and I just want to highlight one more thing from the previous slide, was that the ban was actually lifted. So the date on that was November 20th, I believe, 2 weeks ago. So beginning of November, the ban was lifted in Indiana. They concluded that the rate was low and it was fine to open up social gatherings and whatnot. However, the fact they opened up social distancing too early led to a rise in cases again, noting that influenza wasn't properly contained and a ban was needed, once again. And this kind of extended Indiana's I guess you can say, timeline of the crisis. And as we saw, Indiana's curve became extremely high. Part of it is because they were lacking in the timeline of their social distancing and countermeasures. So to kind of conclude our social distancing research, a couple lessons that we learned were social distancing does result in lower infection rates and lower death tolls. But to kind of go deeper in that point, it's not just social distancing, it's also proper enforcement of social distancing. Recommendations just to wear masks if you're sick or stay home if you're sick. Some of the newspaper clippings gave us insight into the fact that that wasn't actually the case. Whenever it was a governor's order, whenever it was mandatory to wear masks in public, limit social gatherings, this is where we saw in the next week of those newspaper clippings that the death rate was lowering and the cases rising was lowering as well. Second lesson, like I mentioned, ending social distancing too early and too quickly will cause the death rate to increase once again, and social distancing bans will be placed one more time. This is exactly the case that happened in Indiana, and we believe that it was a factor in the high in that high curve that you saw in the diagram. So, kind of going back to looking forward to our next steps in research. Immediate steps that jumps out to us is examining newspapers to understand the variation in death rates by county and city. So we looked at only specific counties, specific newspapers, but to kind of compare, to go even deeper into understanding and to look at social distancing in one county versus another, and to notice how that affected death rate and how, even the change by minute, even that difference by minute, it's still significant because it still relates to how the situation is today. Next question is, does social distancing make a difference in death rates? And while we can make a presumptive conclusion right now with our limited research, I want to refrain from that and say that we actually need to do more research to kind of quantify that result, because only saying yes is not enough. And especially when it relates to today's situation, just saying yes, making a difference is not enough. As we've seen these movements and flatten the curve, it is important to quantify these measures. Next slide. Yep, thank you.
All right, thank you very much, Jacob and Yash, and also your teammates, Matthew and Connor. Really appreciate that. I'll have to admit, I'm the one who added the next steps for research. The more I study this topic, the more I discover there's more that needs to be done. So I'm not necessarily committing them to doing this. I did want to point out that before we get to the next group, Dr. Resnick has offered, if you are watching the video cast, but you're not on Twitter, and you do have questions, you can send them to him to his email. When we get through this next presentation and we get to the discussants, I'll make sure that his email is visible on the screen, and then you can send them directly to him, or like we said, use the hashtag NLMHISTTALK, which is also on the screen. Okay, let me turn over to the third group. I believe Katie and Elisa will be the ones presenting there.
Hi, everyone. You can go to the next slide. I'm Katie Cromer. My team and I focused on the remembering aspect of the 1918 influenza pandemic. I want to introduce my group members, who are Alacia, who will be presenting with me today, Stephanie, and Miguel. Next slide. So we focused on some main questions when diving into how we can remember this pandemic, especially during current times as we are in the COVID-19 pandemic. And we wanted to find out three things. One, what the recovery process looked like. Two, what kind of impact did the second wave have on recovery? And then three, how can we use this data to make sense of the pandemic we are dealing with in present day? Next slide. So when we're discussing this pandemic, it's important to mention what types of bans and restrictions there were before talking about the timeline of restrictions and when they were put into place and when they were lifted, which Alacia will be discussing later on. So when we talk about bans, the main things that occurred were closing of schools, non-essential businesses, and ending public gatherings, such as public dancing and movie theaters. So the newspaper clipping on the right is from Ogden, Utah, which states that groups of 3 or more cannot gather on the street, in stores, basically any public place. There are also many different kinds of travel restrictions. For example, there were restrictions on public transportation, which limited the number of people allowed on streetcars, and certain health measures had to be followed on those public transports. Another interesting travel restriction to mention is that many cities did not allow people to enter the city if they were unable to display that they were in good health. We also saw that in many Western cities, such as San Francisco, there was enforced mask wearing in public places, which is important to note as we are seeing some parallels to this now as similar policies are being laid out across the US. And then lastly, I want to mention in the Ogden, Utah regulations on the right, there was also enforced quarantines inside homes that were known with influenza. So this consisted of maintaining quarantine of the entire household, so no one in or no one out for at least 10 days after the last known fever. And what's also interesting to note here is that the existence of influenza had to be made known in each household by placing a sign-like notification outside of that household. Next slide. And now Alacia will be speaking on the second wave and some timelines.
Hi, I'm Alacia. Okay, so there were only a few cities that we looked at that had a second wave. With the cities that did have a second wave, it was usually very mild and no bans or restrictions were enforced because of the second wave. One city that we did look at that was an exception to this was Salem, Oregon, where the second wave was actually worse than the first wave. Since Salem was one of the only cities we looked at in the West, this could be attributed to the fact that the pandemic spread from the east side of the country to the west, which could have caused a delay in Salem's peak cases. In this city, all of the bans lifted after the first wave were reinforced during the second wave, and the city held more caution in reopening the second time around. Next. This slide shows an overall timeline of how long the pandemic lasted in terms of bans and restrictions on everyday life. The first wave of the pandemic started in October of 1918, which is also when cities began to enforce bans and restrictions, as you can see on the timeline. And this continued all throughout October. By the end of October and throughout November, cities began to ease restrictions and lift the bans set in place. As shown, this was a slow process because cities could not open up everything at once without being cautious. Pensacola shows a good example of this because in the middle of November, they lift some of their bans, but they don't completely open up until the middle of December. The end of December marks the end of the first wave, and by this time, all the bans and restrictions are lifted for the most part. Now, taking a closer look into the second wave, the timeline at the bottom, the earliest one seen was in Ewing at the beginning of December. By the end of December and into January, more cities started to see a mild second wave. In the middle of January is when Salem's second wave restrictions were restated, and these restrictions stayed in place until early February. And by February 10th, the second wave was over, and this is when the new cases of the Spanish flu stopped showing up for the most part. Next slide. Some of the commentary seen from the newspaper shows how life was affected by the pandemic even after it was over. A lot of times there were advertisements posted in the newspaper for possible cures for the flu and vaccinations to end the pandemic. This provided false hope by making people think the pandemic would soon be over or cured when that was not the case. As seen in the Pensacola ad, much after the pandemic, this was about 2 months after the end of the pandemic, there were some mentions of generally treating the flu. This shows that even after the pandemic was gone, people had an overall greater sense of remaining cautious to avoid getting sick in general. In the Harrisburg newspaper, there was a headline after the pandemic titled, 50,000 children left orphans by influenza. This makes us realize that even after the flu was gone, it couldn't just be forgotten and things could not go back to normal because life was completely changed for a lot of people due to the pandemic, including these children that lost their parents. Another headline that stood out because it was used in a few of the newspapers is this one titled "Coughs and Sneezes Spread Diseases." And at the bottom there is, it says, "as dangerous as poison gas shells." This provides evidence that the pandemic had just as much of an impact on the country as the World War did, if not an even greater impact. Next. So we looked at newspaper cover pages before, during, and after the pandemic to see the overall shift in attention towards the flu during the outbreak. And these are cover pages from the Harrisburg Telegraph. To get a good idea of this, we compared how often the war was spoken about and compared that to how often the influenza was spoken about. So looking at the left, 1 month before the pandemic, there was no mention of the pandemic, no advertisements for medication, and obituaries occurred about once a week. As seen, the war has the majority of the city's focus during this time before the pandemic. During the pandemic, a month later, the flu overtakes the attention of the war. Each day, there were at least 10 articles about the pandemic, and there were medication ads on every page. During this time is when obituaries were seen about every day or every other day, compared to every week, because this is when most deaths were seen because of the flu. Next. Looking at a month after the pandemic cases dropped, the flu still seems to be prevalent. There are still some advertisements to medication, and this is when the flu and war both had the same amount of attention in the press, as you can see with the keywords. And then 2 months after the pandemic is when the flu stopped being mentioned in the newspaper on a daily basis. And this is when things start to shift and the newspaper as a whole starts to resemble what it did before the pandemic, with the war being a main focus in daily life. Next.
I'd like to now provide some understanding on the pandemic through Nancy Bristow's book, American Pandemic, which gives very important insight on the aftermath. So two takeaways that we believe to be of significance when remembering the pandemic are how determined the health workers were and the acknowledgement that mistakes were made. It's important to show how strong-willed the health professionals were, and as Bristow states, the public health professionals articulated a seemingly optimistic narrative, forward-looking, confident, full of expression of the opportunities the future promised. And this shows their determination and hopefulness for the future, which is a very powerful statement, especially during this time. And the other takeaway is that mistakes were made. And as Bristow explains in a lecture from Dr. Ravenel, we must confess we made a small failure in our attempt to control the spread. So I think with this, then the question becomes, have we acknowledged these mistakes and have we learned from them, which is a noteworthy thing to be asking during the midst of COVID-19. Next slide. Now that we've discussed the timeline of events and their implications, these are the conclusions that we have made from this. We cannot be quick to forget the devastation that influenza had during 1918 and 1919, not only to those who died, but also those who were affected mentally or emotionally, and also for the family members affected. And we want to emphasize here that life relatively went back to normal about 2 months after we saw the final cases. And to note here, restrictions were lifted once they started to see a decline in the number of cases, in daily cases. And then lastly, in most cases, the second wave did not actually have a greater effect than the first wave. Next slide. So now a question I'm sure we all have is, how are we going to take this information with us as we're navigating COVID-19 in present day, and how we're going to apply it? And here I want to mention both differences and parallels that the 1918 influenza pandemic has with the COVID-19 pandemic. Looking at differences, we see a greater ability to remain anonymous in present day, as influenza deaths were largely advertised in newspapers. And then, as I stated earlier, in cities like Ogden, Utah, households were forced to place signs outside of their homes if they had influenza. And then another aspect is how technology differs. from what we saw in 1918. This includes tracking the spread, where in the influenza pandemic, there was a lack of transparency for various reasons of recording how many people were affected and how many people died. And now we're seeing multiple different tracking websites where we can figure out in real time just how fast things are spreading and figuring out where the hotspots are, things like that. So in general, there's quicker access to information in present day. And it sort of went from updates in local news from cities to the national news because of social media and mainstream media. Now with parallels we see in both 1918 and in present day, many different claims from the media about potential cures or remedies claiming to help with influenza, as we're seeing now with claims to help the coronavirus. And in 1918, we saw in many different newspapers ads for things like Vicks vapor rubs and other medicines, just as we are seeing now with people claiming things about hydroxychloroquine or Pepcid as a cure in those affected. We are also seeing talks about a potential second wave, which we also saw during the influenza pandemic, but they were not as aware of a second wave as we are today. And I think in general, it's important to be aware of all these claims that are being made by the media. And the last parallel that we see is that there must be a decline in cases in order to begin reopening society. So as shown in the newspaper on the newspaper clipping on the right from 1918, they were waiting to see a decrease to go back to normal. And in summary, the parallel is that we are currently in the same situation and waiting for a decrease in cases to reopen society to our new normal. Thank you. Professor Ewing, if you want to take it from here.
Indeed. Thank you very much, Katie and Alicia, and also to your teammates, Stephanie and Miguel. So that's the end of the student presentations. At this point, I'm going to turn it over to Dr. Nancy Bristow and then Deborah Thomas from the Library of Congress and ask for their comments. Dr. Resnick has some comments and has also been collecting questions. And so he can integrate those into his comments as well. But Nancy, let's go ahead and start with you.
Well, thank you so much for including me. Having heard those presentations, I am especially delighted to be here with my distinguished colleagues, but especially with the 12 students who did this incredible work. I am really impressed by the research questions that drove your work, by the careful methodological choices you made, and in turn, really the findings that I think have such significance for us right at this very, very moment. I think you've demonstrated really beautifully Professor Ewing's very point that history matters and that we can actually learn a great deal by crunching numbers and by also integrating in the people of the past in this way that's empathetic. And I think all three of these projects show exactly how that can be done. For group one, I was really, really intrigued by this question of the message or tone that they put forward. And I think your discovery is quite fascinating and certainly resonates with the same dance I think I saw, which is this complex position that leadership seems to find itself in or to believe itself to be in between panicking the public so that they take things seriously and then worrying that they may alarm them and so wanting to go to the more reassuring tone. And clearly that is a dance that must be or a tightrope to walk. I'm not sure the right metaphor, but I think you captured that really well. And that's a really important thing because I think it's, as you say, an ongoing issue for us right now in 2020. A couple of other things I really loved about what you did was the ways in which your project really highlights something that I think people forget about this time period, 1918, 100 years ago, and that's how important the newspapers were, that this was really the source of news for people all over the country, whether you lived in a major city or a small town. Much of your news or most of your news or all of your news came from newspapers. So the way you foregrounded them, I think, was really effective. And then I think that really helps to open up the important question about the need for getting good and accurate information from the authorities. If the newspapers are the place where that was happening, what kind of information were we getting? And again, that's why I love the work you did exploring, your discovery about the ways in which there was this sort of panicky, flashy, I think was the language you used, to talk about how they were at first sort of wanting to alarm or at least excite the public, maybe to sell newspapers, and then the need to step back into a more calming reassurance. What becomes clear as we then turn to the other two projects, I think, is how important it is. If on the one hand, the public needs to be kept calm, I think the public most of all needs good information. And I think that's what we really is reinforced by the other two projects, which again, were both also terrific. The second one, I again, in the context of COVID-19, any research that can continue to enforce the idea that social distancing works is so, so important. And you've done this sort of granular work that helps us see one more time, but in a distinctive way, that social distancing works, but that it also needs to be sustained and that it needs to be enforced. And I think that's particularly interesting because that's not something that's been much in the conversation in the United States. And yet talking with scholars from other parts of the world, enforcement is quite powerful, for instance, in the city of Paris, where you can only travel 1 kilometer, you can only be away from your home for 1 hour, and you have to carry a piece of paper with this information on it every time you go. And the fines are enormous if you're caught breaking the rules. I was really intrigued in turn for group 2 by two things that struck me as surprising. And one was the fact that all death causes also seem to have this strange counterintuitive factor of lower population having higher death rates. And I'd be really curious, but that takes us beyond the flu. More significantly, I think, is the question I was left with about the ways in which thoughtless individuals, I think was the quotation, these people that were breaking the rules were causing a real problem. And for me, that's really a counterintuitive discovery, that it was about people breaking the rules, but they're breaking them in smaller communities where people would actually have known each other. I would have expected a heightened sense of social responsibility in a place, a small town, I live in one, where people really do know each other and where they'll know who it is that's breaking the rules. So I'm really curious about I think you've really opened up something that will offer other historians and scholars questions to try to answer, in addition to those that your professor mentioned. And then finally, for group 3, let me wrap up. Again, I think this is so important to look at the ways in which the public does and does not focus its attention, particularly in a context in which, at the moment, COVID is clearly the center of our attention. In 1918, right, it had to fight with the war, in a sense, to be paid attention to. And I'm fascinated that you were able to discover that in the midst of the pandemic, the coverage was really quite robust. Not all scholars have reached that conclusion, and that's an important corrective, I think. And then you confirm for me one more time that a month after, the flu is still there, but 2 months after, it seems to have disappeared, and the war again takes the public's attention. And I really appreciate then finally this important caution that you give us, that we have to be careful about the ways in which we move on, and that remembering is something more than the newspaper coverage, but that we have to continue to remember all of those people who are actually being critically impacted by this, by their own health issues in the aftermath, or by those that they lose, the orphans, but also the mothers and fathers, the aunts, the sisters, the husbands and wives, that this thing will need to be remembered in the aftermath. And I'm grateful, I think, that so many archivists around the country are already engaged in that work. So finally, let me just say a final word of thanks to all of you for including me, and especially to the students for giving me some new ways to think about what I'm seeing right now, which I think is what some of the best history does. So thank you for that.
Thank you, Nancy. We really appreciate the comments. And there's a lot to think about there. And I know from our previous conversations that, when you studied this topic and wrote the book, that didn't end it for you. You continue to think about why this topic matters and why we need to study history. So we appreciate you making these comments. Deborah Thomas, I think we'll turn it over to you. You have a unique vantage point on the person responsible for all of these newspapers. So go ahead with your comments.
Hi, thanks for having me today. And I wouldn't say I'm the person responsible for this. It's quite the national effort, in that the National Endowment of Humanities and the Library of Congress sponsor the program that's put all these newspapers together. And with the collections that have been developed by state libraries and historical societies and universities all over the country that have been contributed the materials from their collections into Chronicling America. So it's really quite a large effort that's gone into creating this repository that you guys have made such a great use of. It's exciting to see your ability to pull out the pieces of information from the site, from the collection, that are driving the questions and the research interests that you have. And they're really showing us why newspapers are important in terms of historical study. The way we think about newspapers, both at the Library of Congress and in the program, is that newspapers are the voice of the community, the historical record of the community. And this kind of analysis, both cross geographically, different kinds of communities, different size communities, really points out why that's an important aspect to add newspapers into the primary sources that researchers use across different types of disciplines. I think that in the first presentation, it was interesting. It was very interesting to understand a little bit about the dynamic of the tone in the newspapers, depending on the timing, and then the comparison today with our news sources today, where your conclusion was it more depends on the source of the news than over the timing of the news, which is very interesting. And that sort of speaks to the world of journalism we're in today, as opposed to the world of journalism we were in earlier in the century. The second project was also interesting, and I really appreciated the difference the parallels you brought in between Indiana and Missouri and the cross section of those two different geographic locations, and how the localities actually were taking action before the states were. That's a very interesting perspective to bring to it. And one of the questions that brought your research into Lake County brought to mind for me was you investigated and discovered that there was a disobeying of orders going on, as Dr. Bristow was saying. And I wondered whether the newspapers actually would contain more of the community tone of why that was. Was it something in in that community that, they didn't like law and order, or there were a lot of close-knit families who didn't consider each other different people needing public spacing or social distancing? I wanted to know if the newspapers themselves contained that community information on why that kind of behavior would be happening. And in the third presentation, I appreciated all the information about the details that were in the newspapers, the different types of information, the ads, the regulations, the information on the bans, and also the perspective on that long-term effect, and how you utilized the imaging in the news, the functions and features of the website to pull out the comparisons between the different front pages over time. You use the hit highlighting features in the website to show the frequency of the keywords across the different periods that you were looking at. So I thought that was really fascinating, and we'd love to have any feedback you as students have on the website itself, and the use of the collections. And we'd love to hear from you. You can reach me, our website at ndnptech@loc.gov with any comments you have, or I'd be happy to answer any questions you have about the site now. And I'll turn it back over to Tom.
Great. Thank you, Deborah. I appreciate that. I did not mean to suggest that you were the only person involved in this. And I know from working with many of your colleagues that it's a huge effort, not only, from the Library of Congress side, but also all of the state organizations that are supplying all of these newspapers and digitizing them. And of course, we want to thank the National Endowment for the Humanities for providing a lot of the funding for that project, which is a wonderful resource for any kind of historical analysis. As someone who started doing newspaper research on microfilm, as did Nancy Bristow and David Morans, the opportunities created by keyword searching are astonishing. Dave, if you're there, this would be a good chance to make any comments. Dave Morens, if you have them. Excellent.
I am here. Can you all hear me?
Yes, we can.
Okay,
Go ahead.
great. All right. Well, thank you. Thank you for inviting me, and thanks to the students for some really thought-provoking presentations. I won't babble on for too long, but a few things that really struck me I want to comment on, and I'll do that if I can. I think in the first talk, the talk of Louisa and Fiona, commenting on the tone of the message is actually something that was commented on a lot at the time, and it's been covered by historians, professional historians since that time. You know, the city fathers and the public health leaders were divided in what to do. They hadn't seen something like this before, and so some took the track of trying to play down the alarm and calm and soothe, and others took the exact opposite track. And there was quite a bit of discussion about this at the time. So, and if you think about it, there had not been an influenza pandemic in the last 30 years. The one before 1918 was in 1889, and the one before that was in the early 1830s, different years in different places. And so there was really no experience. They had to make this up as they went along using public health reactions that were related to other diseases, which I'll mention in a minute. If you're interested, there was a very interesting TV movie about 30 years ago that was about Royal Copeland, the director of health in New York, and a leading public health nurse who had this dialogue about the very question about how to frame the message and whether public health should be aggressive and honest, or whether they should try to cover it up. And this film, which I don't remember the name of, really got into that issue very well. It's a bit silly. It's a TV movie, half hour or an hour movie, but it does get into this very issue. On the other two presentations by Yash and Jacob and by Katie, they provoke a lot of thoughts. And one is when you think about what we're now calling social distancing, and I would put that in a larger category of public health actions that individual people can do, as opposed to organized public health actions like forcibly isolating you. As I said before, the public health actions that were on the books at the time of 1918 didn't relate to the last pandemic, 1889, because there were very few public health actions then, but they related to what was going on in the decades before that. And if you go back to the 1850s, which is, 70 years before the 1918 pandemic, there were a number of diseases for which public health actions were common. One of them was scarlet fever, which at that time was deadly for children. And if you had scarlet fever in your family, not only might the public health people come and post a quarantine sign, I shouldn't say quarantine, an isolation sign on your door and force you to stay inside, but they would eventually remove you and disinfect your house with carbolic acid, and you couldn't get back in for up to a week. Then later on in the 1800s, there began to be aggressive public health controls against tuberculosis when we realized that we were having a tuberculosis pandemic and it was the major cause of death of adults. And so beginning around the 1880s or so, I can't remember the exact year, there began to be aggressive municipal public health recommendations, which included not spitting, wearing masks, and all sorts of public health things, posters everywhere that were really the prevalent thing on the books when 1918 came along. So a lot of the 1918 actions, such as social distancing and various other things, were borrowed from activities that were already in place for tuberculosis. I also want to mention that it's not been very well discussed by anybody, including historians, but there was in 1918 there was enormous amount of self-isolation. That is, people saying, you know what, bad stuff is happening, I'm going to get out of here. And in fact, it turns out, if you look at history going back even into the ancient times, even before any understanding of the germ theory, the concept of self-isolation from an epidemic disease is intuitive in people. Stone Age people will do that. And, they somehow intuitively understand if you're with a bunch of people, you're going to get sick and die. So not let's not be with a bunch of people. And one of the best recorded examples of that is in 1348, when the plague came to Europe. The bubonic pneumonic plague came to Europe. People self-isolated themselves, those who were wealthy enough and able to do that. And we have that recorded in the famous book Decameron by Giovanni Boccaccio, in which Italians in Firenze and Florence, who were wealthy young people, went out into the Florentine countryside and isolated themselves. And then there was this book written by Boccaccio purporting to be, it's a novel, it's not true, but the situation is true, that people isolated themselves and thereby didn't get the disease. So it's an interesting thing to think about, that public health actions are sort of a mixture of things that public health experts do and things that are intuitive for people to do. And then I think, and that relates, those comments relate to both Yash and Jacob's presentation and to Katie's as well. And one last thing I want to mention, because I think it was Katie, somebody mentioned, I think it was Katie who mentioned the advertisements in the paper for medicines and things like that. This was an era, 1918 was an era in which various nostrums and things were advertised in the newspaper all day, every day, all the time, whether there were pandemics or not. And you could buy, these drugs weren't regulated very well, and you could buy anything over the counter, including poisonous things. And this began to change in 1902 when we had the beginning of an FDA-like activity in the Marine Hospital Service, which became the Public Health Service. And then later on in the late 1920s, we had an FDA. But drugs were beginning to be slightly regulated at the time of 1918, but still you could find them in every major newspaper, I think, that was published would have various drugs being advertised, most of them quack medicine. And people, didn't really know that at the time. The average consumer wasn't aware of what was a real legitimate drug and what was just some snake oil medicine. And when a pandemic would come along, I would think they would rush to get anything that would work, which is exactly what we're seeing now. So I'll just stop there, and thank you all. This has been a really very interesting set of discussions. Thank you.
Thank you, Dr. David Moorens. I really appreciate not only your comments on these presentations, but all of the experience and knowledge that you bring to this topic. You and your colleague, Dr. Jeffrey Taubenberger, have been, so important in keeping awareness up in the public about the significance of the 1918 influenza. We had the centennial just 2 years ago, so that was a good chance to review the lessons. But everything we've seen over the last 6 or 8 weeks is just a reminder, as you said, that these public health measures are ones that require, changes in behavior. They require understanding, they require knowledge, but they also require, a consistency in the messaging. And as you pointed out, in 1918, you really do see this division. Sometimes you see the same person, taking both sides, saying this is a problem, we have to do something, but don't worry, don't be alarmed. And that's, you can imagine how that would be challenging for the population. Okay, Dr. Resnick, go ahead.
Excuse me, can I just butt in for 1 second? Because you mentioned Dr. Taubenberger, I just wanted to say that Dr. Taubenberger is online, not through the Zoom connection, but through the other one. But he's listening very intently, and I'll speak for him and say he's very grateful too. So,
please convey our thanks to him. He's also doing incredibly important work right now. All right, Dr. Resnick, I think if you want to make some comments, and then I think you've mentioned some questions coming in to your email. So if you can summarize those or select from those, and then we'll turn it back over to the students to respond to some of these questions and comments.
Sure, thanks, Tom. Before I begin, let me share my email address, JEFFREY, Resnick, REZNICK @nih.gov, a publicly available email address. If anyone wishes to email me directly, I'll be happy to convey questions. I have 3 already, which I'll share at the end of my comments. And if any others come in, I'll certainly add them. So I'd like to focus my comments on these excellent presentations, speaking to your slide number 14, Tom, which addresses the important perspective of why history matters during an epidemic. To my eye, these presentations reflect a really remarkable moment as historical research pursued in real time, that is, in a real historically significant time. Each one demonstrates how and why history matters. They do it very well, and why taking a long view of a current event, in this case, the pandemic we're all facing, can help us think more critically and learn lessons about the present, and think critically about the foreseeable future, as well as the distant future, in which our society will inevitably face another pandemic, as societies always have. These presentations help us understand the very currency of history, if you will, as we experience a historic moment, again, in real time, and appreciate this moment in the continuum of history, past, present, and really future. But there's another aspect to these presentations which I just would like to surface. They give us pause to realize that the current pandemic itself will one day be a historical moment, which will be studied in the context of past pandemics. A future generation will look back on these presentations, and I would argue this symposium and others that are being held, as examples of historical research at a historic time, reflecting on the past through the lens of the present and with an eye to the future. This realization can help us appreciate that just as newspapers of the 1918-1919 period have become sources through which these students have studied the contemporary pandemic, media of today, so very, very much of it born digital, will become tomorrow's historical record through which future scholars will study the COVID-19 pandemic. And certainly, as Nancy Bristow mentioned in her comments, archives and libraries, and I'll add, including the National Library of Medicine, are now actively acquiring selected portions of this massive born digital record of the current pandemic to preserve it for that future historical research and scientific research. It makes me wonder, perhaps 100 years from now, I'm going to go out on a limb here, that a great-grandchild of one of the students who presented today will look back on the project of her or his great-grandmother or great-grandfather to make sense of a pandemic that they will be facing, and how preserved digital media of the early 21st century holds lessons for that future point in time. I realize this might be pie in the sky thinking, but then again, here we are at a historic time, learning how these students have appreciated the historical record to make sense of that past and certainly the present. Their work, and here I'd like to underscore what Dr. Morin shared, is part of a historical continuum, stretching back 100 years and further back, relevant to today, and pointing to what really is a future historical record. So with those comments, let me share the few questions that I've received, and they're excellent ones. In the current pandemic, someone writes, the rationale for flattening the curve is not to overwhelm hospital capacity at any given time. Was there similar discussion or strategy regarding hospital capacity in 1918? I'll start with that question, and then I'll share the others in due course. So was there, to the students, was there a similar discussion or strategy regarding hospital capacity in 1918? That the rationale for flattening the curve then was not to overwhelm hospital capacity at any given time. Anyone see that in the primary source material?
So this is probably a question from the newspapers. Anyone want to handle that one? I'm going to have to, do the teacher thing and call on somebody.
My newspaper, the one I looked at was Salem. They talked about a shortage of nurses, so they didn't really talk about taking measures for for not overwhelming the hospitals, but they did mention shortage of nurses. So they were considering taking women from the city and making them or teaching them how to be nurses, but I didn't see any effort towards relieving the hospital capacity.
Thank you, Alicia. That's helpful. I think the place where this comes up most acutely, as Nancy Bristow knows very well, was on East Coast cities. So Boston, initially Philadelphia, New York, put out urgent pleas to have nurses sent to those cities. And then, of course, because the war was going on, many physicians and nurses had been drafted or had volunteered and had gone into the Army Medical Corps. So they weren't even in their cities or their hometowns. And so you do see evidence of that in some of these newspapers. I don't remember any examples, where public health officials articulated exactly the sequence that we heard right from the beginning of COVID-19, which is if we can, again, the term flattening the curve, if we can decrease the number of new cases, we can delay the number of deaths, the number of hospitalizations, and so on. That, as far as I have seen in the historical materials, was not part of the kind of predictions or the calculations, but you could certainly see that in the example I started with from New York City, which is that there is about a week to 10-day lag between the increase in the number of cases and then the increase in the number of deaths. So that is exactly the curve, that we are dealing with right now, and trying to approach. I mean, one of the things that's important about the 1918 influenza is that in many communities, the first victims were either in army camps that were often located outside of, but relatively close to, major cities, or in the case of university towns like Columbia, Missouri, or Blacksburg, Virginia, the first cases and even sometimes the first deaths were among the recruits and the trainees and the officers. And so that, in some of the initial coverage in the newspapers, actually started with those populations, either the army camps outside the cities, or if it was a university, the students. And so you start to see some of the attention there, and then it spreads more broadly into the rest of the community. More questions, Jeff?
Yes. So thank you both. So another question that was received was a question about the first wave of the pandemic, actually being in the spring of 1918. And this individual asks if the students or you, Tom, could explain the earliest wave. And I think this question probably arises because of the emphasis on the newspaper reporting that the students shared being at the peak of the pandemic. So from late September to early November 1918, and perhaps there wasn't the emphasis on the earliest wave of the pandemic. So could you speak to that and with the confirmation that it was actually spring of 1918, the pandemic didn't begin in the fall of 1918. If you could talk to that point, this questioner would appreciate it.
Yeah, let me address it briefly. And then one of the questions the students asked or started with when they were doing the newspaper projects was, when did the first cases appear in those communities? So let me address the main part of that question, and then if there's any of the students who want to talk about that from their newspaper case studies, they would be welcome to do so. I'm actually going to defer to, or I'm going to quote, I believe, Dave Morin, something that he said when he talked with the teachers in the summer seminar a couple of years ago. And I hope I don't get this wrong. He said there are lots of waves. There are lots of ways where the influenza, kind of suddenly increases. It's noticed in some places, and in other times it's not. Sometimes there's an increase in cases, but very few deaths, and so it doesn't get a lot of attention. And so I think if we think of waves visually, the metaphor, where they rise up and then they go down and then they rise up again, that's not necessarily the best way to actually understand what the sequence was in 1918. It's a little bit misleading. The most frequently cited example comes from Kansas in early March of 1918, where there was a sudden increase in cases, first in an army camp and then a little bit in the community. But there's not a lot of attention to pay to that at the time. It's only subsequently that the Army Medical Corps go back and say, oh yeah, there were a lot of these cases and they were influenza. It then appears in Europe in the summer of 1918. This is where it gets the name Spanish influenza, because there are a lot of cases in Spain, and because Spain is a neutral in World War I, there's more possibilities of reporting on cases than there are in the belligerent countries. But already by June of 1918, international newspapers, including Britain and the United States, are reporting on the number of cases not only in Spain, but also in Germany and then in England. So you clearly have, a lot of cases that are coming to public attention, not just of the medical community, but also of obviously the military are interested in this, but also civilians to the newspaper. And this actually becomes a crisis on the front lines because the German army in particular, they have so many men out sick that it really affects their capacity to launch a new offensive, which they want to do at the end of summer of 1918. But then it comes to the United States, and this is where it's not only becomes most widespread, but most deadly. And so you can talk, I think, about a genuine wave of influenza starting in late August, early September in Massachusetts, Camp Devens outside of Boston, and then spreading across the country unevenly, inconsistently. But by September, October, early November, it's everywhere. And that's why the case studies the students looked at really focused on those stages. So it depends on whether you call that the first wave or the second wave. Then you talk about how it goes away and then comes back in many communities. But I think what the group presentation that Katie and Alicia made from the third group is really saying that other wave that starts in November is also very uneven, but it's also not nearly as deadly. It goes on longer, and so many people do die in that stage, but it doesn't have the intensity. Where in a big city you're talking about hundreds of deaths each week, or even in smaller communities, tens and 20s, and in a small town. So there are very, very different stages. And again, as they mentioned, given what we're going through right now with COVID-19, this is an urgent question. Not only what's happening with case rates and death rates, but if you relax social distancing measures too soon, too quickly, what will happen? Will you have an increase in infections and then an increase in deaths? So this is exactly what we're trying to figure out through this project. From the students, anyone want to talk about what you found in your newspaper in terms of some of these early reports, and then what happens as the number of cases start to increase?
I think as you mentioned before, like just to reiterate that it was difficult to track, like where people would say, oh, it's the first wave or the second wave, as there was really only newspapers to look at, and the newspapers are dictated by the media. So like as a historian, you can't pick up on things if it's not being reported. So, and the media didn't pick up on the increasing number of cases until like early October or late September in a lot of different cities. And then also just looking at the way it spread, it was also hard to track because of that, as it kind of spread through the country from like eastern cities to western cities. So the timeline is kind of all over the place when you look at it in terms of that. So yeah, that's just another reason why it's difficult to have a consecutive timeline.
Thank you, Katie. I appreciate that. That was very, very helpful. And I think one of the things that was surprising, I'm thinking of the second group, in those examples they cited, in Missouri and Indiana, many of these communities that follow the closing order issued by the State Board of Health did so before they had any deaths, and in some cases, not even any influenza cases. And that's where you see, I think going back to Nancy Bristow, one of your questions, there is some resistance to that. Why do we need to close the theaters or close the schools, or especially cancel church services when no one around here is being sick? And that gets into this whole people in the big cities are getting sick, but not here in these communities. And so this is why we're especially interested in some of these smaller populations, that seem to have such high death rates, both overall and also from, particularly from influenza, and asking, is this a question of demographics or something about these populations that's increasing these death rates, or is it more specifically how they implemented these public health measures or perhaps did not? So those are some of the things we're continuing to look at. Jeff, were there more questions?
Yes, there were several pertaining to death rates by racial disparity. If the students or you could speak to the degree to which they came across any evidence of rates of sickness and or fatality by race, and to what extent was this data recorded in public health statistics, and how did it surface in the newspapers that were studied?
So we looked at this some using the U.S. Census documents. Fiona, I don't want to put you on the spot, but as I recall, that was something your group looked at early on. You want to address that?
Yeah, I was just about to say I could make a comment about it. Yeah, specifically, we had a group that looked at comparisons between those of color who contracted influenza or pneumonia and those of white populations. And we found that normally they would have colored, or they would have attention on those who were Black that had African American descent who contracted influenza, and those cases were much smaller, but they also had a category just colored, and we didn't know if that pertained to any other minorities because they weren't specified. Oftentimes there were often like obituaries and information in the newspapers about notable white individuals who contracted influenza, and it was important that they were showcased so that the public could see, oh, these were individuals who were very significant in their communities, and it's important to pay attention to how this influenza is impacting the community. But oftentimes for colored or African American cases, those were only given as numbers. They weren't really specified as to who contracted it, how they contracted it, or anything like that. And obviously the numbers were much smaller, but there was some record of like influenza cases by race.
Fiona, thank you. That's very helpful. And this is certainly something that deserves a lot of attention, not only in doing research on the 1918 influenza, but as we think about the connections and the continuities to the discussions now about how COVID-19 rates, both for infection and for testing, but also for deaths, how they perpetuate racial inequalities in our society, and particularly the kind of structural issues around health. I want to give credit for the 1918 influenza to Vanessa Northington Gamble, professor of history at George Washington University, who's done a couple of really excellent research projects comparing the way that influenza not only the death rates within the population, but particularly the attention to this disease. And she made extensive use of the African American newspapers from 1918, many of which are in chronicling America, because in the mainstream newspapers, the white newspapers, which has been the focus of this project, they often paid very, very little attention to minority populations, and they just would disappear. The health departments, they did pay attention and often would classify in their vital statistics, race was one of the important categories that they used, along with gender and age and occupation. And they were, of course, obsessed with immigrant status. And so they, would compare death rates not only between citizens or by ethnicity, but also by birthplace of mother, because they were really wanted to make sure, they wanted to prove, that native-born populations were healthier than those born from immigrant parents and went back generations. And so this was a primary concern in the early 20th century, and it needs to be part of the discussion. And as Fiona mentioned, often there was a single category. There would be, category of white, and then there would be a category of colored. And depending on the state, that may be only African Americans, but particularly in the West Coast, that could also include Japanese Americans, Chinese Americans, or the overarching category Mexicans. So even that kind of statistics that were coded by race aren't always reliable in terms of addressing these questions. And certainly this is something that Nancy Bristow has looks at quite extensively in American Pandemic, as well as looking at differences by social class and gender in her work. So I would encourage whoever asked that excellent question, to go and look at those materials and follow up on those. We have just a couple minutes left. Jeff, were there any other questions?
There are two that I'll pull out. They address the subject of impact of the pandemic. Several questions on the degree to which the newspapers show evidence
I can't hear you.
Of concern of closure of usual activities. And can you hear me now, Tom?
Yeah.
Okay. These are questions about impact, the degree to which the newspapers show economic impact on usual activity that closed, and impact directly on hospital personnel and hospital challenges that the pandemic caused. This was addressed briefly, but I've gotten several questions about these economic impact and hospital impact.
Okay, any of you see this in your newspapers? And this evidence of kind of community impact. Stephanie?
Yeah, so our group tried to look for how the stock market was affected and how day-to-day economic things were affected. We really couldn't find much in the newspapers, but one of the big things was all of the advertisements started focusing towards home remedies and medicines to cure or help influenza. Basically, the entire focus was shifted, whether it be economic, whether it be just articles, all of it was focused towards influenza. And so they didn't really focus on how the stock market or how the economy was doing, more than switching the focus on to kind of a distraction.
Thank you. Yeah, that's helpful. And actually there was a question posted on Twitter about the war and the relationship between influenza and the war. And I think that, as I think back on this project and what all the students have done researching, it's incredibly important to remember that this, United States was in the middle of a war. The war comes to an end on November 11th. And one of the issues for these public health measures is, can people go out and celebrate the end of the war? They desperately want to go out and have a parade and see each other, and under the public health guidelines up through the end of October, that wouldn't have been allowed. And so I think there is this sense in which the war comes to an end. In most places, the disease recedes. Where the number of everything goes down, it kind of falls out of attention in the newspapers. And that's a really important part of the context for understanding, not just what happened during the influenza, but why people didn't remember it. And again, this is something Nancy Bristow in her book, looks at really thoughtfully is why did this kind of recede from public memory really until the last 10 or 20 years, when there's been a lot more attention to it by historians. And then obviously now because of the parallels. I'm watching the clock. This has been wonderful. Thank you very much to all of the students for pulling together these presentations, for all of your work this semester. My thanks to the discussants, Nancy Bristow, Deborah Thomas, Jeff Resnick, and especially David Morans, who was able to join us and offer his comments. My thanks to Lindsay France from National Library of Medicine for managing the technology. I think we just barely made it. And I appreciate everything that the National Library of Medicine has done, not only to host this video cast, but all of their support for student projects over the years. So thank you very, very much. Appreciate it. Jeff, did you have any final comments?
Oh, Tom, thanks to you. Thanks to our students and Nancy, Deborah, Dave Morans, and everyone out there listening. Much appreciated your time and attention, and kudos to the students for their outstanding research. So thank you all very much, and thank you, Tom.
Thank you.